So an important approach to solving health-related and social problems in the community is the public health approach. And this approach involves 4 primary steps. The first step is defining the problem. This is also referred to as data surveillance, and it really gets at the magnitude of the problem. Who does it affect, where, and does it change over time? So decision makers can use these data to identify when, where, and to whom programs and resources should be allocated. The second step in this process is to identify risk and protective factors. So what factors in subgroups of the population put people at risk or protect them? These data assist program planners in developing and implementing programs that can reduce risk factors and or increase factors that may be protective. So this would be sort of the primary prevention part of the public health approach. A third step involves developing, testing, and evaluating control or intervention strategies. Prevention strategies are implemented in at-risk communities and control or intervention programs in communities that are already affected by the problem. So this is sometimes referred to as secondary prevention or control. This step also involves the evaluation of the program. And of course, this is very important to determine how effective it is and if it should be replicated. So that really gets to step 4, where you are assuring widespread adoption of these programs and services. So that would involve sharing the knowledge between researchers, policymakers, program evaluators, stakeholders, and communities. And only effective programs then would be disseminated and replicated. So applying the public health approach to childhood problems in Allegheny County might involve looking at childhood obesity, for example. So we know that childhood obesity is becoming an epidemic in the country, but we don't really know the magnitude of the problem in Allegheny County at the level of the individual child. So one approach would be to collect existing demographic, health-related, and school-related data from elementary schools in Allegheny County. This would allow us to determine subgroups of the population who may be at high or low risk of obesity, and then to develop programs around those populations to address their needs. Another example of using the public health approach to address an important problem is something that I've been involved with for about 20 years, and it's called the Allegheny County Injury Surveillance System. And that's a data surveillance system consisting of crime, emergency department, and trauma registry information. And in this initiative, we can monitor trends in violent crime over time and look at how it may be changing in response to things like economic development around the city or changes in housing patterns, school-related issues. And again, that would allow us to identify high and low risk groups and perhaps assist program planners in developing primary or secondary prevention programs around violence. These are both examples of initiatives that can use the public health approach in reducing or eliminating significant childhood-related problems in the population.